Post-traumatic stress disorder, or PTSD, can happen to anyone who experiences or sees a traumatic event unfold. When these events happen, your emotions trigger changes in your brain that leave a lasting impression on how you feel, how you respond to those feelings, and how you move through the world around you. Here are 4 common signs of PTSD. 1. Avoidance. Having PTSD is a lot like being on autopilot. As much as you try to navigate life's daily obstacles, you might find yourself avoiding people, places, situations, and events that trigger your feelings or remind you of your original trauma. This happens because your brain wants to keep your body safe. For example, if you've been in a car accident and feel anxious about getting behind the wheel, you may choose to walk or take public transportation instead. 2. Being on edge. Sometimes, if you have PTSD, you may feel differently about things you used to love or enjoy doing, especially if it causes you to recall your original trauma. And these feelings of anxiety can surface unexpectedly and without warning. For instance, if you were robbed on a sunny afternoon, warm weather days might cause anxiety and discomfort. 3. Negative thoughts and feelings. Sadness, anger, and distrust are all heavy, difficult emotions to manage on our own. Add in the constant reminder of a traumatic event, and it's no wonder why many people with PTSD may turn to substance use or other harmful mechanisms to drown out the pain. While these coping strategies may help in the short run, they can perpetuate a vicious cycle of negative emotions and intrusive thoughts. 4. Retriggering trauma. There's no time limit on trauma, and healing isn't linear. PTSD can flare up weeks, months, or even years later, and it can happen in the form of flashbacks, nightmares, or intrusive thoughts that you can't shake off. For example, if a loved one died unexpectedly, but years later you hear a song that reminds you of them, you may re-experience the emotions and physical symptoms associated with grief, anxiety, and sadness. It's important to remember that you are not alone in your battle with PTSD, and you're not defined by the trauma that has happened to you. If you experience any of these warning signs, or you're concerned for your mental health, talk to your healthcare provider about possible treatments for PTSD.